Assalamu alaikum students. Today I will tell you about the important terms and definitions of pathology. What are the important terms and uh, definitions? Number first is the ischemia. What is the ischemia? Ischemia is the shortage of blood supply to the heart muscles or any muscles in the body, like in the brain, in liver, in the kidneys. Shortage of blood occurs, and this is known as the ischemia. Ischemia usually happens because of a shortage of blood and oxygen to the heart muscle. It is usually due to narrowing or blockage of one or more of the coronary arteries which supply blood to the heart muscle. In many cases, ischemia is a temporary problem. Number first is Number second is the hypoxia. Hypoxia is a loss of blood supply to any organ. Okay. Definition is the a deficiency of oxygen reaching the tissues of the body. There are four types, which is known as number first is the hypoxemic. Like in hypoxemic condition, there is a loss of blood, low level of oxygen content, like from low blood oxygen content leads to hypoxemic. Number second is the anemic from low blood oxygen carrying capacity. Number fourth is the distributive from low blood flow, and the number fourth is the histotoxic like from poisoning. These four types is of hypoxia are necessary to study because you have to differentiate between the ischemia, hypoxia and necrosis. If not reversed quickly, hypoxia can lead to necrosis, tissue death as in heart attack. Now, now I will tell you about the differentiation of ischemia and hypoxia. Ischemia is the insufficient blood flow to provide adequate oxygenation, while hypoxia is leads to tissue hypoxia, reduced oxygen or anoxia, absence of oxygen. Ischemia is always results in hypoxia. Hypoxia can occur without ischemia if, for example, the oxygen content of the arterial blood decreases as occurs with anemia. Number third is the necrosis. Necrosis is the premature death of cells and living tissue. Necrosis is caused by factors external to the cell or tissue, such as infection, toxins, or trauma. Number fourth is infarction. Obsolete term for fracture, especially one without displacement. The term myocardial infarction focuses on the myocardium, the heart muscle, and the changes that occur in it due to sudden deprivation of circulatory blood. The main change in necrosis of myocardial tissue is called then what's the difference between the necrosis and infarction? Infarction refers to tissue death necrosis that is caused by a local lack of oxygen to an organ. The most common type of infarction people are familiar with an myocardial infarction or heart attack. Basically, one or more of the coronary arteries that supply the heart with blood gets occluded from atherosclerosis, hardening and thickening of the arteries. Because the blood can no longer reach that particular portion of the heart, the portion of the heart muscle die. When portions of the heart muscle die, it can cause an arrhythmia, irregular heartbeat, and the patient has a heart attack. This is the phenomena of heart attack, how the heart attack occurs. Now it's atrophy. Atrophy is a decrease in size of a body part, cell, organ, or tissue. In atrophy of an organ or body part, there may be a reduction in the number or in the size of the component cells or in both. One example of atrophy is the progressive loss of bone that occurs in osteoporosis. This is termed as atrophy. Now, what is hypertrophy? Number six one is hypertrophy terminology of in pathology. Abnormal enlargement of part or organ, excessive growth or accumulation of any kind. Cardiac hypertrophy is a thickening of the heart muscle myocardium, which results in a decrease in size of the chamber of the heart, including the left and right ventricles. A common cause of cardiac hypertrophy is high blood pressure and heart valve stenosis. Now, differentiation between the atrophy and hypertrophy is that in hypertrophy, the rate of synthesis is much higher than the rate of degradation of muscle contractile proteins, leading to an increase in the size or volume of an organ due to enlargement of existing cells. While Atrophy, when a muscle remains in disuse for a long period, the rate of degradation of contractile proteins becomes greater than the rate of replacement, resulting in muscle atrophy. In hypertrophy, defect may occur as a result of lack of nutrition, loss of nerve supply, microgravity, aging, systemic disease, prolonged immobilization, or disuse. While atrophy, this defect may occur as a result of lack of nutrition, loss of nerve supply, microgravity, aging, systemic disease, prolonged immobilization, or disuse. These two are defects or same. While in hyperplasia, this disease is associated with the increase in number of cells. As a result of this disease, an organ can get enlarged. The cells look like normal cells, but they are more in number if we compare them with normal human body. Number 8 is metastasis. Metaplasia, transformation of one tissue into another, abnormal replacement of cells of one type of cells of another. This is a pseudo-stratified respiratory when one type of cell is converted into another type of cell due to some body due to for the maintenance of body homeostasis. This process is known as metaplasia. Now, differentiation between hyperplasia and metaplasia is that hyperplasia is increased cell numbers in response to hormones and other growth factors, occurs in tissues whose cells are able to divide or contain abundant tissue stem cells, whereas metaplasia is change in phenotype of differentiated cells, often in response to chronic irritation that makes cells better able to withstand the stress, usually induced by altered differentiation pathway of tissue stem cells, may result in reduced functions or increased propensity for malignant transformation. Now you can see that the aplasia is defined as the incomplete or faulty development of an organ or body part. Thumb hypoplasia, also commonly called hypoplastic thumb, means that your child's thumb is unusually small or underdeveloped. Thumb hyperplasia means that your child's thumb is missing altogether. Like if your child thumb is not present, then this means that your child thumb have aplasia. Anaplasia is a change in the structure of cells and their orientation to each other. Ana means excessive and plasia means formation. This abnormal cell development is characteristic of tumor formation. The differentiation between aplasia and anaplasia is that aplasia is when entire organ or part of an organ is missing, means incomplete tissue formation, while anaplasia is abnormally tissue formation. When differentiation of cells get back to the original cells, this situation is called anaplasia. Thank you so much.